Hi everyone, hope you're all doing well. Just wanted to go over some of our items from last week and also the week to come. So last week was just kind of giving you that overview of marketing and kind of what marketing is, some tools, concepts, what marketing folks do, etc. So that was kind of our overview from last week. And then we had our discussion, our written assignment, and our quiz. So hopefully that all went okay for you. But what is what is important is that we understand, and we'll learn more about this as we move along, but kind of the differences in the roles in marketing. So there's marketing, there's sales, there's public relations, there's all of these different areas that are sometimes joined together in a single department, but they have very different focuses, I guess. Each group does things differently. So you think about right now with all that's going on, the public relations department or the public relations area in a hospital probably pretty busy, especially a high-profile hospital may have patients, inpatient with dealing with this illness, maybe has some high-profile researchers that are doing work. So that public relations department or side of the department is very busy. Marketing probably not quite as busy right now. They're probably helping to support the public relations effort. So just really important to know that there's a lot of different things, and a lot of times we don't think of. A lot of times when we think of marketing, we think of advertisements, and marketing is so much more broad than that, as we're going to talk about throughout the class. So in week two, we are kind of digging into the environment. So the marketing environment, the things that we look at for marketing, how marketing influences different people, etc. So in our discussion this week, we have thinking about your own personal healthcare choices and how you make them and what motivates you as a consumer. And then we also have a written assignment with some healthcare slogans. And there are many, many, many healthcare slogans on this document. So review that, identify 10 of your favorites, and then talk about why those appeal to you. And the purpose is to really give an idea of why hospitals do certain things, etc. So kind of an interesting exercise. Then we have a quiz and our Ed puzzle this week as well. So I just want to go over a couple of the quiz questions from last week. So the first question, a customer is one who uses the product or service purchased. So that's false. The customer is the person that purchases it. So it's not necessarily the one that uses it. So think, probably the easiest way to think of that concept is like a child. So oftentimes children require healthcare services and goods, but they are not the one purchasing them. So technically the customer is the parent or whomever is purchasing on behalf of the child, but they are the consumer. So the consumer is the person that uses the product or service. The customer is the person that purchases it. Next question, which is not a skill of a marketing person? So at least in the print version of the book on page 9, there's a listing of marketing skills. So marketers rely on 7 traditional skills: marketing research, product design, distribution, pricing, advertising, sales promotion, and sales management. So those are all the skills that they've noted there. And the one that they haven't listed is media control. So media control does tend to fall to public relations. And like I said at the beginning, sometimes they fall within the same department at a hospital, but the control of the media really falls to those PR professionals, the folks that know how to manage that and deal with that regularly. So market research, absolutely marketing. Pricing and sales management, yep, those fall within marketing as well. But media control does not. Next question, it's the last one I have, I believe. Sales promotion includes advertising. So the answer to that is false. Advertising is kind of its own thing. Sales promotion is about, think about, how people may use advertising to promote sales promotion type things. Sales promotion tends to be incentives to get you to buy something. So think about the retail sector. It's really easy to think about marketing when you think about the retail sector. So you may have an organization that says, okay, if you come to buy this item, high ticket item today, we'll throw in a $100 Visa gift card and you'll get 20% off. So that, $100 Visa gift card, 20% off, that's sales promotion. It's an incentive to purchase something, as opposed to advertising, which is exactly what it sounds like, advertising. Advertising is its own, kind of its own being, its own beast within marketing, and we may use advertising to promote our incentives, but they are not. They're not certainly not the same thing. So that's why our answer here is false. I think, yep, that's it. That's the last question there. So that's what we've got for this week. I know that everyone's, kind of having a trying time right now. It's difficult to adapt to, to all of what's been going on, kind of this new world. But I encourage everyone to, to follow the advice of our government, as they're telling us to stay home and stay away from folks, and follow what the healthcare folks are telling us, and just do your best to really fulfill what's being asked, and then hopefully we'll be able to curtail this and get back to our lives as they were prior to that. And just today, and it doesn't impact us because we are already a fully virtual program, but for any of you that are in the in our ground programs, classes have been canceled for the rest of the term, and moved to the, well, not canceled, but moved to the virtual environment. So originally it was supposed to be later in April, then it was earlier in April, and now it is through the end of the term, through finals week. So look to your faculty, be patient with faculty. Folks like myself and Dr. Hampy and Dr. Frendak, we live in this virtual world all of the time, but some of your on-ground faculty may not. And it's going to be a transition for them, just like it is for you guys. So be patient with your faculty, and hopefully, if you're not hearing from them, please feel free to reach out to one of your, whomever your advisor is. One of the three of us will help you to fetter these things out, but hopefully things will go as smoothly as can be expected, and we'll get through the rest of the term without issue. So be safe, and if you have any problems, need any assistance, please feel free to reach out. Okay, thanks so much.